Welcome back to Champions of Care, brought to you by Oakwood Healthcare. Today we're talking about women's health issues, and we're very fortunate to have with us in the studio Dr. Charles Cash. He's an obstetrician and a gynecologist, and he's head of women's services for Oakwood Healthcare. Thank you for being with us, Dr. Cash. We're so happy to have you.
Mary, thank you for having me.
Now, this might be like stating the obvious, but you're a man. What got you into obstetrician gynecology work?
Well, Mary, it started a long time ago when I was a medical student, and we go through rotations. One of those was OB/GYN rotation, and I was just awestruck when I attended my first delivery and assisted in that patient's delivery. It was an amazing miracle. And from that time, it just grew, and the interest grew as a fourth-year student, and then I decided to do a residency. And it's still an amazing privilege, and I use that word sincerely. It is a privilege that women allow me to take care of them. I really enjoy being able to. It's a fulfilling career for me.
You've been doing some very important gynecological things that involve surgery and a woman's quality of life. Tell us a little bit more about that.
Well, what is really fascinating in 2011 is the ability to direct the care in a right-sized way for a particular problem for women.
Right-sized? What do you mean by that?
Well, for instance, if a woman has a bleeding problem, she has heavy periods or crampy periods, what you can do is go anywhere from medical therapy to an intrauterine device to ablation or destruction of the endometrium to a hysterectomy, whether it's a vaginal, robotic, laparoscopic. So there's a whole arsenal or a host of opportunities for treatment along to the ultimate treatment, which may be a hysterectomy. Prior to that, though, as things funnel down, fewer and fewer women are requiring hysterectomies because of the technology that we have.
Now, Dr. Cash, you mentioned the kind of problems which might bring a woman into your office, and you said a bleeding problem. You know, this is a sexist generalization of mine, but I think women just shrug a lot of stuff off and say, I'll just live with this. You know, oh, this is natural, this is normal, my mother had this. What, besides bleeding problems, are some of those things we should watch for and now know, hey, there may be some help for this in addition to bleeding problems?
Well, again, I think that you've made a good point. Not only do women feel that this is something you have to live with, many doctors feel the same way. And again, it's surprising when you look at how do you propagate medical knowledge not only to the community at large, but the medical community. It's a difficult task. So when we talk about someone who has heavy periods or severe cramping, and many times it can be debilitating where they miss work, when it's talked about what are the opportunities for treatment, it's, well, you need a hysterectomy. And the answer is no, you don't. You can ablate the endometrium. It's an 8-minute procedure in the office. It's virtually a treatment. Women go back to work the next day or the following day, and they are satisfied. So when we talk about treatments for women, we talk about quality, we talk about effectiveness, and we talk about patient satisfaction. And if I can have a patient satisfied with the treatment short of doing a super aggressive therapy, that's satisfying for me also.
And Dr. Cash, you're so good at explaining things, but you used a term I don't really understand, ablate. What does that mean?
To ablate means to remove, or you would treat or remove the endometrial lining, because we know that in at least 25 to 30% of all women who used to have hysterectomies, you're able to just remove that lining and the problem is solved. The bleeding is solved, the cramping is solved, the quality of life goes back to a high level again, and they're able to enjoy their life professionally and with their families. That's what that's all about.
So keep the parts, remove the problem.
Yes.
Now these are surgical procedures, but there are a lot of technologies now to make this much less invasive. And you know, do I have to stay overnight in the hospital?
No, and indeed we're doing these in the office. We migrated this technology in the office probably about 5 or 6 years ago, and it's been very, again, well accepted, very satisfying for the patients. Hospitals are wonderful. However, you get IVs, you see strangers that you don't know, there's a parking issue. There are a lot of practical things that go into when you have a hospital procedure and a hospital stay. In the office, you're in a friendly environment. You know the people that you have are taking care of you. Some of these women I've seen for 10, 20, 30 years. So it's about comfort and convenience when you're able to bring procedures into the office. And that's what the ablation is about. And indeed, we also do tubals in the office now.
Tubal
ligations,
okay.
Sterilizations for women in the office. Probably about 5 or 6 years ago, again, we transitioned that to the office so that out of 100 tubals, I may do 1 or 2 in the hospital. The vast majority of those are done in the office. They take about 2 or 3 minutes to do.
Wow.
The patient stays for about 10 minutes afterwards, and 75% of the in-office tubals that are done go back to work the same day.
Wow, that's amazing.
95% go back to work the next day. So it's an amazing technology. If someone would have said this to me 10 or 15 years ago, I would have just been blown away by that. But it's very exciting to be able to offer these technologies in the office and have them be safe, efficacious, and satisfying. One of the take-home messages here is be informed. Feel comfortable with your doctor. Ask questions. Get the answers. Weigh the answers. Do they make sense? Does it make sense for me when I'm looking into having my treatment? And if it does, fine. If it doesn't, you know, you can always get another opinion. But the key is it's about information. It's about weighing the information and acting upon it.
Well, it's all about acting upon it, and we're urging our viewers to make an annual physical, to call their physician if they have something that's been bothering them. Maybe there is a treatment for it. And I want to thank you so much for the wisdom you've shared with our viewers today, Dr. Cash. You're accepting new patients at your office in Dearborn, is that correct?
Yes, I am. One last message, though.
Okay.
Please ask questions. Please feel comfortable, because it's your body, and it's critical that you understand what's going on.
Well, that's really good advice for all women and the men who are watching too. Thanks so much for being with us. And in a minute, right after a very short break, we're going to come back and talk a little bit more about some surgical specialties and new treatment options available. Stay with us. Want to learn more about a topic presented on Champions of Care? The Oakwood Speakers Bureau brings health information directly to you at your workplace, community center, church, or school for free. Oakwood physicians and clinical experts present a wide range of interesting healthcare topics. From the lunchroom to the boardroom, Oakwood Speakers Bureau is your free health education resource. For more information, visit oakwood.org or call 313-586-4902.